Hi, I'm Dr. Anna Insola, founder of Hearing Doctors. Welcome to Ask the Hearing Doctors. And we have a special guest here with us today from OtoSet. And she is Miss Jackie Phillips. She's the Vice President of Sales.
Yes, thank you so much. I'm Jackie Phillips, as Anna said. I work for SoftCon Health, and we have the OtoSet that we're going to discuss about today.
So Jackie, tell me about OtoSet. What does it mean? How was it born? And what does that mean to the clinicians and patients?
Absolutely. So basically, OtoSet actually started many years ago. It started with our co-founder, who actually had impaction in his left ear. He woke up one morning, could not hear out of his ear, was panicked, went to his mother, and she didn't know what to do, so she took him to the doctor, the physician, and he looks in the ears and realizes that the left ear is completely impacted. So he tells his mom, don't worry, there's no problem here, we're just going to clean out the ear, but you're going to probably have to have this ear cleaned out from time to time because it does collect wax more than it should. So throughout his life, he was going to the physicians. He's either having microsuction or irrigation performed in his left ear. It was extremely uncomfortable growing up. So when he became a bioengineer and wanted to actually have a solution for the problem he had growing up, because he felt like there was nothing on the market that was actually had a patient comfort and was easy and simple to use. So he invented the OtoSet, because he said, why don't we have something that's not intimidating to the patient or the clinician? So a headset is not intimidating. So he designed a headset that actually pairs together microsuction and irrigation, the two different methods he had growing up that were very uncomfortable. He pairs it together into a very safe and patient-friendly device called the OtoSet.
That's fantastic. And so who would you, as clinicians, I'm really interested in knowing more about who is this for?
Yeah, this is FDA cleared. It is the only product on the market that's actually FDA cleared for 18 years and older, clinical use only. So this is for clinicians in their clinic when they have patients who has a major impaction, they would go turn to this and put this on their patient.
Wow. And tell me about some like statistics. Who has cerumen or wax?
It's a great question. So the numbers show that one out of 10 children have wax impaction. It's 1 out of 20 for adults, and actually when you hit 65, it goes to 1 in 3 adults. And then it's roughly, in the US alone, roughly about 35 million patients a year have impaction. And each month there's over 1 million people seeking professional help for this problem.
Are there specific conditions or possible patients that we should not be using this on?
Absolutely. So if a patient has a hole or a perforation in their eardrum, or active ear infections, or a history of infections, major surgeries, those patients, when you're doing the case history, make sure you cover that, and those would eliminate those for irrigation.
That's really good. That's really good. And why do you think it's important for the impacted wax or possibly impacted wax to be removed?
Because the patient, like our co-founder, woke up and felt like he had a hearing loss. So it causes a conductive hearing loss, which is basically just a temporary hearing loss. So it's nothing major, but if you do have it, the patient's going to feel very muffled or like they're underwater. They can't really hear very clearly, and it really limits them through their day of hearing properly.
And how fast do you think we can get this done?
Yeah, that's great. The great thing about it is only a 30-second procedure, okay, each cycle. Total time for the patient expect is no more than 15 minutes or less. So it could go from as low as 5 minutes to 15 minutes, and they can be in and out, cleaned, and hearing much better. And most people, after they have their cleaning, they immediately will say, I can actually hear much better now. Yeah. And it could their hearing loss easily could just be wax. It may not be anything else but that.
Yeah, and that's why I think Hearing Doctors was so interested in this product, because I thought that if our patients come in and they're impacted with wax, I can get it done immediately and go on with the procedures that they actually came in here for. And that's why I think it's such a great addition to our equipment and state-of-the-art equipment that we have here.
So many clinicians that I see have to refer their patient out to another specialty. And patients come in, they really want one place they can go. They want us to come in and see you and not have to leave you. Right. And so being able to see them and take care of all their hearing needs is added value for sure.
And with now OTC, I'm sure you have something to say about that. I think my biggest fear as a clinician is that, patients may go around and buy a over-the-counter solution for themselves, but nobody's really looking in their ears first. And I think that that's something important. Do you have something to say?
Yeah, absolutely. So if they go somewhere and get something over the counter or online, they have their device. It could be working initially, but over some time, the wax that they have actually can get into the hearing aid and plug or stop the hearing aid or actually break the hearing aid. So they're going to have to seek a professional like you to come in and see, like, well, I got this hearing aid, it's not working anymore, and you can look in the ear and go, it's because you have impaction that needs to be cleaned. So it's definitely something that's going to help people with over the counter because they don't have anybody to help clean their ears like you.
Yeah, but I don't want them to get a hearing aid or an OTC thinking that they have a hearing loss when it's just pure wax.
Exactly, and that too, yes, they actually that's a good point. So that they feel like they have that hearing loss, they feel muffled all the time. They could go years like that. I've seen people impacted for 2 years. And they just learn to deal with it to the point where they can't deal with it any longer. It affects them in their life. So they could go over the counter, get something, and still be having the problem. And they really should have come to see you. You could remove the wax, and guess what? That plug that was in their ear opens up, and they can hear everything, and they never needed a hearing aid.
So Jackie, let's talk about why is it important for the patients to seek professional help when it comes to wax or cerumen removal?
That's a great question because a lot of patients will instantly go online and seek advice online how to get their wax out, and there's thousands of different remedies and methods online that actually could do way more harm to the patient than if they go and seek a professional to have this professionally clean out of their ears. It takes 5 to 10, 15 minutes to get out of their ears safely versus something they get online that actually they may have to go to a physician to actually have it corrected because they have damaged their ears so badly. And I've seen messes from patients and heard from them that they've actually burned their ears, they've scraped their ears, they've actually pulled the wax out and there was bleeding because the wax was attached to the ear canal. And when they come see a professional can properly look in the ear and realize exactly what's going on inside their ear and what the best method to use.
So we all know that there are many other methods out there that we all utilize, but what makes this OtoSet so special?
Well, as our co-founder, he wanted something that was not intimidating, so the headset, but he also wanted something that was going to be automated. So this is the only automated system on the market where the clinician puts this on the patient's head, presses the button, and the device actually does everything for the patient and for the clinician. And when it's finished, they put it on back on the stand. But also what's unique too is that it has standardized pressure. So there's no user error. So when I say it's automated, the device is doing all the work. It makes sure that the pressure that goes in and the water that goes into the ear is going at a direct angle to the wall of the ear canal and not directly towards the eardrum, which is a safety feature. Also, it's always having the same amount of pressure going into the ear and never someone being able to make their own choice of what pressure. It does it for you.
So it sounds like it's safe, it's comfortable, less intimidating, and fast.
Yes,
I love it.
Exactly.
Thank you. Let's show our friends how to make this work.
All right, perfect. Thank you.
Great. Thanks.
So Allison, it's very first thing that we do before we even begin the procedure is actually look into your ear canal with an otoscope. Okay, and why that's so important is because we want to make sure how much wax do you have, what type of wax do you have, what size of ear canal you have, and if it's curvy or straight. Because the reason why that's so important is because with the OtoSet, we place the headset on your ear, but there's a little tip that goes into your ear canal, and we want to make sure that we have it angled just properly into the ear canal so you get the best result with your earwax cleaning.
Good, fantastic. Okay, so I'm just gonna pull back in the ear, like so. That looks really nice. Thank you. Let's do the other ear. And that looks...
So now we've looked in your ear. The next step that we would do is actually, I'm going to show you how this feels and the sensation of the tip in your ear. So I'm going to place this medical grade silicone tip in your ear, and I'm going to lift up, and that's exactly how I want it to feel when you have it on your ear, on your head. Okay? So I'm going to ask you to kind of help me guide this into your ear. So, and I'm going to tighten this to the head, just like a headset, That feel okay? Okay, you can let go. So chin up. So you're gonna hear 3 beeps. Once you hear the 3 beeps, you're gonna hear water, feel and hear water rushing into your ear canal. Okay, and at the same time, there's gonna be microsuction, meaning it's gonna be pulling that water in the waste out of your ear canal into the headset. So here we go. This is cool. Okay, so it's going to be 20 seconds of water and microsuction at the same time. In the last 10 seconds, right now, we're hearing the suction only, and it's going to be drying out the ear and pulling out any waste that was left in the ear canal into the waste container. So just like that, it's finished, and I'm going to take this off your ear, and so I'm going to lift up. And then what is best practice is to always look in your ear afterwards to see how clean your ear is and make sure there's nothing left in your ear.
That's great. How do you feel?
Good.
Yeah? Excellent. Let me just take a quick peek. This is really important. That looks very, very good. And this way. Thank you so much. That was great. Thank you, Jackie. This has been an amazing session, really removing wax very sexy.
Yes.
And for those of you who want to get the same done, please visit our website, hearinggdoctors.com.
If you're in the Washington metropolitan area and you'd like to schedule an appointment with hearing doctors, click the link in the description or visit hearinggdoctors.com.